Hey everybody, welcome to another episode of CCRM TV. I'm Dr. James Nodler. I'm a REI, a fertility doctor with CCRM in Houston. And next to me is my wife, Dr. Abby Nodler, who is our special guest. She's a psychiatrist, and so she gives us a lot of insight into the mental health aspects of fertility. So in this episode, we wanted to talk about coping with job stress. So this is something that I hear about with our patients all the time. And, Dr. Nodler, there's a few different aspects of that I was thinking of kind of hitting on. So one is, losing a job, which is obviously a big stressor, and it's something we see a lot with COVID. Another is insurance. So is my job being supportive to me in terms of providing fertility insurance? And then another is, can I get to work on time? Is my employer being supportive of me? Do I have to be secretive of this? And so these are all kind of things that I'm thinking about here. So, just to start off, with COVID, job losses. Because for our patients, that can mean loss of income and loss of insurance. So what are some things that people can do to cope with a job loss, at least from a mental health perspective?
Right, and I think a lot of adults, especially those who are looking towards, creating a family, a lot of our identity is wrapped up in our line of work. So that's what you do most of the day. You spend most of your day at work trying to make money, make ends meet, but you also hopefully enjoy some of that work. And it does become a big part of our identity, and it can be incredibly painful to lose a job, even if it's a job you weren't totally satisfied with. And so I think taking some time to process that and being mindful of the mindset that can set in is that, like, if I lose my job, I've lost everything. There is a lot of loss, but it doesn't mean that you are not worth anything or you don't have any value. But that it is like we've talked in a previous episode about a loss. It's a big one, and that to just be mindful that it's not a loss of your self-worth and you as a person is the first step.
So thank you for that. And then another aspect that I hear from patients all the time is, maybe my job's not being supportive. Like I have a lot of physician patients, for example, that they have to get to work early, and coming to monitoring visits is really tough. Or, they're afraid to tell their employer that they're even going through treatment because they think that they'll be maybe discriminated against. How do you think we could maybe tactfully talk to our employers or try to get our employers to be more supportive of us when we're going through fertility treatment?
And I think the big thing in my mind is trust. So in any relationship, whether it's a work relationship or a friend relationship or a familial relationship, is if I can sort of trust this entity, this person, this organization, I tend to be more honest and open and in that vulnerability and saying, hey, I'm going through this treatment or I need to have this doctor's visit. I think that's the first thing you have to ask yourself, if you trust them to share that information with. And then if you do, sharing what you feel comfortable sharing and knowing that they can have a feeling about it or a thought about it. And then working with your team at CCRM to figure out sort of when are these visits, what's to be expected, so that I can communicate, if not why I'm leaving, that I will not be there, but that I can make the time up or I can, stay late that day, and make a plan.
Yeah, and so, and I know that's, Dr. Nodler, what you spend a lot of time with your patients doing is working on communication. And I think that's the key to what you said. That's what I took from it is communication. So that's on both sides. That's both with your employer and with your CCRM team. I know that here in Houston, my office at the Houston Medical Center is right down the street from the largest medical center in the world. People are busy. We try to be flexible with patients. So if there's someone that needs to come a little earlier, a little bit later for a monitoring visit, we want to work with them because we know that this is important, but there are other important aspects to people's lives. And then on top of that, like you said, communication. There's a big stigma on fertility and infertility that people don't want to talk about it. They think that, no one will care about them. But I think you'd be surprised in my experience that when you speak to them as a human,
right,
they can get more on board, and then maybe life can get a little bit easier.
Right. And then on the communication piece, I think the other thing is logistically. Like, I think the one bright spot of COVID is that most physicians have learned to sort of work with telemedicine. And in that, if it doesn't involve a procedure, it can be done much more fluidly.
Mm-hmm.
So instead of spending the 30 minutes to get to the clinic and sitting in the waiting room, having the visit, and then driving back, you can simply log on, right? Like you could do that from your car and get your privacy, but also attend to the visit and meet with your team in a way that's less intrusive to the rest of your day.
Yeah.
But I would definitely reach out and let the team know, hey, here are my constraints at work. Can you work with me?
Yeah. And so on that note, we'll wrap up this episode, but as it was a good segue from Dr. Nodler, we're offering telehealth visits in our offices, I think all of our offices throughout the network. We're also seeing patients in person, and we're happy to see you and work with you. Take care.